This Remittance and Status, or R&S Reports video, is part 1 of a 3-part series. In this video, we'll provide you with some general information and details how to set permissions to access R&S reports. Parts 2 and 3 focus on how to read your R&S reports. While providers and financial management services agencies, or FMSAs, can submit claims daily, R&S reports are generated twice a week and are available every Saturday and Wednesday. R&S reports generated on Saturday list claims processed from the previous week between close of business, or COB, Tuesday through COB Friday. R&S reports generated on Wednesday list claims processed from the previous Friday, after COB, through COB Tuesday of the current week. There are 2 formats for R&S reports: a PDF format and an electronic format. The PDF format of the R&S report is the most commonly used and lists claims submitted and processed during a reporting period. You'll also see the other claims finalized during the reporting period, pending claims from the previous reporting period, system adjustments, and recoupment claims. We'll talk about the electronic format later in this video. A TMHP account administrator must create and grant permissions for users to access TexMedConnect. To assign permissions, the account administrator needs to log in to My Account and select the correct options in the Permissions section. If the user needs to view 835 files or R&S reports, the account administrator selects the View 835 Reports or R&S Report Viewer permissions. If the user needs access to both formats, select both options. Account administrators can refer to Step 3 in the TMHP Account Setup for HCS and Texas Home Living Waiver Programs QRG to learn how to set permissions for user access to TexMedConnect. Once the account administrator has set your permissions for TexMedConnect, log into My Account through the Texas Medicaid and Healthcare Partnership, or TMHP website. Select Change Your Remittance and Status Reports R&S COF Delivery Method. Click the checkbox by the agreement statement and then click Change R&S Delivery Method. If you work with multiple contracts, you'll need to set R&S permissions for each one. Multiple users from the same provider contract can access the report through TexMedConnect located on the TMHP website. Keep in mind that R&S historical records are determined based on when you set R&S permissions for each contract. You'll only see reports going back 90 days from when you set the permissions, and only if claims have been previously submitted during that time. Another thing to note is that PDF versions of the R&S reports remain available for 90 days after posting. Once the 90 days expire, R&S reports are deleted from TexMedConnect, and you won't be able to access them again. It's strongly recommended that you save the R&S reports to your desktop or another local folder to ensure you have access to them even after they're removed from TexMedConnect. The Electronic Data Interchange, or EDI, ANSI 835 Electronic Remittance and Status, or ER&S report is Health Insurance Portability and Accountability Act, or HIPAA, compliant, and can be accessed by providers and FMSAs who use third-party software. To receive ER&S reports, submit a completed EDI agreement to TMHP. You'll receive a submitter ID and password once your EDI agreement is successfully processed. Log into TexMedConnect, click ANSI 835, and enter your submitter ID and password to access the ER&S report. 835 ER&S reports only list non-pending and finalized claims. You can download the report up to 30 days after the report is posted, but we should note that once an ER&S report is downloaded, it won't be available to other users. However, you can contact the TMHP EDI department to recover downloaded reports. For more information on 835 ER&S reports, reference the 835 Long-Term Care Companion Guide on the TMHP website. In this Part 1 video, we reviewed general information about R&S reports and showed you how to set permissions to access your reports. In Part 2, we'll review the non-pending claims section of the R&S report. In Part 3, we'll discuss Sections 2 through 4, pending claims, financial summary, and EOB codes and descriptions.